Hi everyone! In this video, I'm going to share with you my top tips for a better induction experience. My name's Jenny. I am a certified holistic doula, childbirth educator, placenta specialist, and a postpartum doula, and I'm here to help you follow your own compass in birth. Let's make birth better together. So, first of all, one really big tip I have for a better experience is that you do not have to have an induction of labor if you don't want one. So you are the center of the spiral in birth. So if your provider suggests that you need to have an induction of labor, for example, because you're getting close to your due date or you're past your due date, you are the center of the spiral and you get to make that choice, free from coercion or any other kind of bias or influence. It's your birth, it's your family, and you can follow your own compass. You do not have to consent to an induction of labor if you don't want one. So we're going to start off talking about what happens in the induction process. And I think it can be really important to understand what the process looks like before consenting to an induction or before you're forced to make that choice so that you know what to expect from each step of the process. I'm really big on helping people know what to expect, even in the event that there are medical choices that need to be made. So, first of all, what happens in an induction? In a hospital induction of labor, what happens usually is you will be asked to come in at night for a process that's called cervical ripening. It's basically a process that helps to prepare your cervix to open up for the birth process. Something really interesting about induction is that in pregnancy, your body tells your cervix to stay thick and closed to protect you and your baby during this time. And then when we have an induction, it takes a little bit to basically trick your body to do the opposite. So an induction can be a long process. You'll go in at night and they'll use what's called a cervical ripening medication. There are many different things that are used, so I won't talk about a specific medication, but they'll place it at the cervix and it will help your cervix to soften and start to open to be prepared to go into labor. Then once the cervix is softened and opened, sometimes they may choose to use something called a Foley bulb, which will basically mechanically dilate the cervix a little bit more depending on how much the cervical ripening medication worked. That's also an option that's out there and that doesn't include any medication. So then after that, once your cervix is favorable to start Pitocin, they will use Pitocin to start contractions. Pitocin is what is called synthetic oxytocin. Pitocin does not cross the blood-brain barrier in the same way that your natural oxytocin does. So it functions a little bit differently in the body in that it simply will mechanically start contractions for the labor process. So induction of labor can be done for a variety of different reasons. There are a variety of different medical conditions and concerns that would lead a provider to recommend induction. Often, I see induction of labor recommended when a parent moves close to or beyond their due date. This is something that we see very frequently, especially where I live. We often see providers recommend inductions at 39 weeks for most birthing people. So it's important to know also that, like I said earlier, you do not have to have an induction of labor if you don't want one. So I'd like to share a story. I had a client who was planning an intervention-free natural birth experience but they developed high blood pressure in their pregnancy, and their doctor was really concerned about it and recommended an induction. So once they talked with their provider, they decided that they felt safer for their baby to come earthside rather than wait. So they used a medication to soften the cervix. And when there wasn't really good progress with that, instead of jumping to Pitocin, we suggested trying using a Foley bulb to help make the cervix become more favorable before starting Pitocin. And sometimes that can make it more likely that your induction will work. So then once their cervix was dilated enough and ready and contractions were already kind of starting, Pitocin was slowly administered in just little increments, and that was enough to push their labor along, and they were able to have the Pitocin turned off and their baby came earthside. So thanks so much for listening today. I want you to go ahead and stay tuned for part 2 of this series, where I'm going to talk all about some really important information that you need to know when you're faced with choosing an induction of labor. Go ahead and follow my YouTube channel, Mindful Mama Birth Services.